Good afternoon or good morning. I don't know what time of day are you watching me today.
That's right. That's right.
My name is Rex. I'm one of the unit-based educator here in infirmary. So, unit-based educator. I take care of 3 units: 4 north, which is the ortho floor; 4 northeast, which is the spine, urology, and outpatient surgery floor; 4 west, which is the general surgery. All right. I've been here for almost 2 years now in infirmary. I've been enjoying education. I'm enjoying the team that I'm working with every day. All right. Again, I couldn't say thank you enough. Thank you for all the work that you do and the service that you do for our patients. And one of the things that I would also discuss this afternoon, or I always say afternoon because we're filming this afternoon, CAUTI prevention. We're trying to make sure that we don't harm the patient further. So this is also one of our nursing quality indicators as far as infection. We want you to be aware of the kit that we're using here and then the policies and procedures that involve CAUTI prevention. So I'll kind of review some of the statistics that we have in here. So we're going to review these protocols, policies, and procedures, should I say also algorithms that will also prevent us from having the CAUTI. So 2017, I'm just comparing ourselves to the CHI whole system. We have 74 CAUTIs in CHI, and we have the highest as far as CAUTI. 2018, we went down to 43 CAUTIs. 2019, we got 18 CAUTIs. So a 32% reduction as far as CAUTIs. So we're doing something right. Yes, we're doing something right. And we want to keep doing it like we are on the same, or we are the correct path of doing it. So I have given you cards. You can also play at home if you want to. You have a yes or no. Just say yes or no. We're going to start with some series of questions that you would mostly think when you have patients with Foley. So let's start with present on admission. This one you don't need your card for now. So this one, if patient has a Foley, present of admission, what do you usually do if the doctor ordered to collect urine for urine culture or for urinalysis? What would you do? What would you do if the doctor ordered to collect urine? The patient's Foley's been there. It's from home, it's from a nursing home, or from another facility.
Do not take the specimen from the Foley catheter.
Very good.
Or from the bag.
Yes, very good. So you have to remove it, and then you have to collect it from...
But they have that little urine port. Can I draw it from that?
No.
No, absolutely
Not
no.
from the Foley.
Absolutely no. Absolutely no.
Yes.
Yeah, we will discuss that further later. All right. Okay. All right. The next situation. The patient is here. The Foley was inserted here. It's been 24 hours. The patient is from, let's say, a med surg, went to the unit. The Foley's been more than 24 hours. The same situation. The doctor ordered to collect urine for urine culture and for urinalysis. Do you collect it from the existing Foley? No. It is a no. It is a no. So we don't collect it there anymore. So we have to remove it. So 24 hours. Do you know the reason why?
Bacteria has already formed, not only on the port for where you would even try to scrub it off, it will not come off.
Perfect. So yes, evidence says that the more you keep the Foley, the more that you put the patient high risk. The longer the Foley stays in place, the longer that you will put the patient high risk for Foley infection. All right. Does the patient meet the medical necessity? So you always have to ask yourself about that. Do you have the right reason to even keep that Foley in? So even on your kit, you can see there, stop. Does the patient meet the CDC guidelines? So if none of those 6 reasons in there, you don't have it there, you might think twice, do I really need to insert this Foley or not? Also, if you look at our policy, when you go to the algorithms, nurse-driven urinary catheter removal protocol, you also have those reasons right there. It's embedded in the policy. Also, when you go to your nursing station, you will see this ring, you just say flip chart in here. These are all embedded in our policy. So we want it more efficient and more available to you. You don't have to open the policy because these are attachments on the policy. So you don't have to go all the way. You just have it there. It's readily available.
That's so nice.
All right, yes. Yeah, very efficient. So it's like your, should I say, your roadmap for if you're caught in between clinical decision making, should I remove this, should I not? But be aware, we have also 4 different reasons that you want to keep it. You might want to think twice to remove that Foley. So if it's a urinary, if the patient got urethral injury, bladder injury, patient have it for their chronic paraplegic or quadriplegic patient, you want to call the doctor, might be a heart insertion, or a catheter inserted by the urology himself. So you don't want to be in that situation. Oh my God, why did you remove it? So think twice. And so yeah, so make sure that you have the right reason. And we always make sure that each CAUTI incident, we really serious about it. We do root cause analysis. In fact, without this crisis right now, every day, our medical director, our managers, our infection control preventionists, in that medical library we have there 9 o'clock in the morning, they have to review all lines. How many, don't be surprised that your manager would always ask you every day, how come you have the Foley in there? So you have to be ready with those questions like, why do you still have that Foley? So again, go back to your medical necessity. If you don't need it, you don't have to have it. So that's how we deal with it. And so, the next one, I need your cards.
Okay.
Both of your cards. Do I need a second person to insert Foley?
Yes.
Wow, everyone is so updated with their practice. So yes, we have. yes, I'm impressed. So we need a secondary person. So we did not just we want to penalize the nurses that we want to have one. So we also check other magnet hospitals, other hospitals that don't even have CAUTI in their institution. So they're doing first person witness.
Yes.
Now, so if you establish that you need a witness, can a PCT witness a Foley insertion?
No.
Very good. One answered. One answered yes. So no. So PCT, it's first and foremost, it's not in their scope of practice that they're going to insert a Foley, and we haven't trained them to insert Foley. So they're not allowed to insert Foley or even a
They
witness.
would not know if we broke sterile field.
Perfect. Yes. So in fact nowadays, take that mindset that the second person is not just a person that will just watch you if you have the correct positioning of the patient. That particular person will help you maintain your sterility. And then on the EMR, when you document your Foley, consider like Foley insertion giving your highlight medications, or you're giving blood.
Yes.
When you give blood. So you have to have that second person. In fact, you have to type your name and then put your RN, or an LPN can also be your witness when you do your second person. The next question. So what do we do if the patient is allergic to latex or betadine? What do we do?
Soap and water.
Soap and water for allergic to betadine. Very good. Very good. What about for allergic to latex? What do we do?
Silicone.
Latex free. So even you yourself, as a nurse, is allergic to latex, you can do your latex free kit. This is not typically stocked in our nurse's station or in your Pyxis. This is the one that usually stocked in there. So you have to go down, sample supply, to get this. So you sometimes you would have to have a second follow-up question. Does the patient really, with going back to the betadine, are they really allergic to betadine? Maybe sometimes they're just allergic to some things that they have eaten or something, and then they generalize. So you should ask the patient. But then again, if they have true allergy to betadine, use soap and water. All right? And it's not gonna hurt if you assess your patient that you clean before you even do your, on this kit, we also have the Castile soap, so you still have another second cleaning for the patient, and then we'll just use the Castile soap. All right? Do we need to use stat lock or securement device?
Yes.
Yes, very good. We need to use it. So, if we need to use the stat lock, how often should we change the stat lock?
7 days.
Every 7 days. So, what do we put? Everyone is, I'm so impressed. Everyone, so how do we, what do we write on our stat lock?
Date, time, initial.
Date, time, and initials. Very good, very good. So you always, so take note, the date that you put on your stat lock is not the date that you changed or you inserted your Foley. It's the date that you changed your stat lock, because sometimes there's confusion. Gone were the days that we also use ink markers on the back of your Foley bag that we put when we insert the Foley. We're not using that anymore, so we're not gonna do
Why
that as well.
not?
Yeah, why not?
Yeah, because of yes. What was it?
Because it all comes out together. So when you're changing your Foley catheter, you're changing the bag.
Very
and
good.
it's all coming
Yes,
out.
it's a closed system.
Closed system.
It's a closed system. And the only true indication that we would know when did you insert your Foley is in your documentation in each chart. So we're not gonna document anywhere. Alright? So we have reviewed the stat lock, the nurse-driven protocol. Is everyone familiar with the air vent on your Foley bag? Air vent. Yes or no? No?
Sarah says no, she's never
No?
seen it.
Maybe 50-50. Okay, so the air vent, one of our responsibility, I'll show you later when we'll have a closer look. I will demonstrate how to perform your Foley insertion. We'll have a closer look where's the air vent. So the air vent, your responsibility is always make sure that your air vent is dry. Because if it sticks on the other side of your Foley bag, it does not maintain the negative pressure on your Foley. So Foley, or basically the function of your air vent, it facilitates the drainage of your urine on your bag. So if it's wet, it's not maintain the negative pressure, your urine will just hang out on your tubing, so it would not directly flow on your bag. And then when the transporter comes, when you pick up the bag, and then they put the Foley above the bladder, and then what will happen? Urine will regurgitate, and you get urine infection. So one thing, you're responsible to make sure your urine bag is always, the air vent is always dry. Alright? And then, as far as the urine on your Foley bag, what's the goal? Do we always keep it half full, or do we keep it always full?
Should empty the bag at half full.
Half full, always half full. Again, the goal is for that air vent not to get wet. Alright, what happens if your air vent gets wet?
You have to take the whole Foley catheter out and get
insert
a whole new Foley catheter.
Yes, very good. Because again, there's the red seal. It's a mortal sin. Don't ever break that seal, because that's, again, going back again to our principle, closed system, always closed.
I have a question.
Yes.
I had a urologist come to the bedside and he wanted me to break the red seal to manually irrigate my Foley catheter. What should I do?
You should search yourself, and the doctors. We have also that you're alone there. We have also educated the doctors that they are not supposed to order to irrigate from your Foley. They should reinsert a 3-way Foley catheter, and that you can irrigate from the 3-way Foley catheter.
Thank you, that was so helpful.
You're welcome. Yeah, thank you for your question. Yeah. So, how often should we do perineal care?
Every shift in PRN.
And what do we use?
Soap and water.
Just soap and water. Very good. In some institutions, some nurses, several orientation that I have done before, they would ask you, they would tell you chlorhexidine. So they have a chlorhexidine key on the practices that they have, and then so on this policy, yes. So we don't want you to use chlorhexidine, especially in the female genitalia. Yes. So here, just use soap and water. Yes, it's a big no, right?
Can the PCT do the cleaning of the perineal area?
yes, they can clean. We have educated them, and they know also that they have to do it every shift with soap and water. And what will you do after you do your perineal care?
Document it.
You have to document it. So again, if we have an incident of infection, we have to make sure that we do all these things. So we do root cause analysis. What is a root cause analysis? So we dig deeper into the issue. The first thing on the checklist, did they collect the urine from the newly inserted Foley? That's the first one. The second one, did they have a witness? Boom. Did they have done their perineal care? Boom. Did they have a stat lab? Boom. So all of those things. And so if they have missed one of those, we will re-educate the whole unit, not just that particular nurse. So the whole unit or the whole healthcare team that involved in that particular care of that patient. All right? Moving on. So also, you are also covered for removal of, you don't even need an order to remove your Foley. So again, follow your algorithm. And if you don't have the right reason, I mean, you don't have to have the Foley. So let's say we already removed the Foley. So you would have thought that your responsibility is done after you remove your Foley. You still have responsibility. Every hour, what would you do after you remove your Foley?
Help the patient try to pee, get
Yes.
up to the bathroom.
Every hour, make sure that you have to check on them. Let's say after 6 hours now, the patient still did not void. What would you do?
You get the bladder scanner.
You get the bladder scanner. Again, you also have here your algorithm. So go back on your algorithm, urinary retention protocol. So you have this, and then you follow your map. Even you don't have to even wait for the patient to have 300, or even if 151 to 300, you already feel something. Yeah, you have to do a bladder scan, call the doctor, and follow your algorithm. All right? So follow your algorithm.
When I was little, they used to put our hand in warm water. We used to pee just like that.
Oh, wow. All right, moving on. So our goal is not to insert Foley as much as we can, right? So one of our initiative here in the infirmary, which was started, I think a year, right? Correct me if I'm wrong, maybe a year. All right, so we started the PureWick. Is anyone familiar with PureWick? No? No?
Kind of. We don't
Maybe,
use them a
kind
lot
of.
in the ICU, but
Okay.
more now than we used to.
Okay, so is anyone familiar with the male, the Texas condom catheter? Texas
Yes.
condom catheter, yes, you're familiar with it. So the same principle. For male, we use the Texas condom catheter. For female, we use PureWick. PureWick is the FEM, they call it the female external, FEC, female external catheter, right? So the same principle, so always make sure, so you would ask yourself first, who are the patients that we can use PureWick? So you will receive also a packet about PureWick. It will be attached as a PDF, most likely on your email. You get all the reasons there to also like who are those patients that will have the PureWick. So first thing first, they should be alert and oriented. They can follow instructions. Otherwise, if they're anxious, it will not stay in place, right? Always make sure also those patients that are on bed rest, but they can still pee, all right? So urine needs to come out. The same thing with a male condom catheter, urine needs to come out because otherwise there's no point of using this. This is external, it doesn't go in, basically.
So incontinence is fine, but not retention.
Yes, but not retention. That's the most the basic contraindication. I mean, if it's bladder obstruction, urinary obstruction, you need a real Foley, not just a PureWick. All right. I will get me here model, and I will demonstrate how you would use it. Here on the side.
All right, before you start that, I'm going to come over there a little
Sure.
closer.
Or he can come to your table.
Either way.
Anyway, maybe on this side. I'm almost done. I'm just gonna do it on this side.
I like the cards.
Me too. This is fun. It was like,
I think that's kind of it.
You've done a little both.
yeah,
that good? You're good?
Jeopardy fun.
Okay. All right. So first thing that you will do is you will grab your pure wick. So let's review the parts first. So this part is like the soft gauze part right here. This will absorb the urine from here. And then when I open it, try to disintegrate it. So you would have the tubing here on this side. You would have thought that inside your tubing you would have holes in here and it will absorb the urine from there, but no. So this cloth will absorb the urine and then we'll collect it from here at the bottom, and then the suctioning would go out from here. So from here to here. First thing that you will do, you do your perineal care, right? After you do your perineal care, using your clean gloves as well. So you connect your tubings. You start with your long tubing. And then you connect it here. Top. Connect the other end of your tubing to your vacuum. So patient right there. And then vacuum right here. And this goes to the wall suction. So the wall suction on your handout, which will be given to you, it tells you to start with 40. And then you put your suction on continuous suction, not on intermittent compared to your NG tube. So this is a continuous suction. So start with 40. And as you go, if you feel that the patient is leaking, you go additional 20, so 60. And then after an hour, if the patient is still leaking, you're going to go to 80. All right, so maximum is 80. Again, you start from this soft portion. Your Alright, so your landmark is your pubic bone right here, and then you put there, and then in the anal right there. Alright, you would have thought your next questions might be like, how can I keep it in place? So you have to have, I forgot to bring one, you have to have a mesh panty. So the mesh panties will keep it in place. And I was informed, I haven't used this personally to a patient, experience using pure wick myself for a patient. They said that the more the anatomy, the more it will stay in place. And patients in the unit, nurses in the unit, they love this because this is very accurate as far as intake and output. This is pinkicle. Yeah.
It's a lot better than them being incontinent
Yes.
and not being able to know for sure.
So keep that. I'll give you a little bit of a trivia. It started the innovation of PureWick started with a husband and wife. The wife is the patient, and the husband is an engineer. So he's very innovative. So the wife is incontinent, wants to help the wife. So after a follow-up checkup, the medical intern saw the device that the husband created for the wife, and so he saw that, and then there's something potential about it, and so this is, I think, the 15th prototype of that innovation and then PureWick bought this to him, like for, let's say, about $1 million. So keep that innovative mind while you create some innovations. So, yeah. All right. Next question. Using your cards. I have questions about PureWick. Do I need an order? To use PureWick?
No.
Yes, you don't need it. You don't need an order because, again, this is non-invasive. This doesn't go inside. The same thing. Think about your male Texas condom catheter. You don't need an order for that, so you don't need an order. Can a PCT start PureWick?
Yes.
Yes or no? They could not. Yeah, they could not.
There's an assessment that has to take place first,
Yes.
right?
Yeah. So
Only the nurse
the root word is start. So again, clinical decision making, nursing assessment, patient education, clinical decision making starts with the licensed personnel. All right. So once you have started your PureWick, you can ask the PCT to change it. We have educated them how to change it, and so yeah, they can change it. Next question: how often should we change PureWick?
Every shift.
Yes, every shift. So manufacturer on the handouts that will be given to you, it says 8 to 12 hours, but our policy says every 12 hours, right? So make sure that you change your pure wick every 12 hours. Every change of shift, you should have a new pure wick to have it with you. All right. Any questions so far as pure wick? Yes.
How many times do I have to bladder scan my patient before I can put a catheter in them, straight catheter?
How many times would you bladder scan the patient?
Yeah, like for example, I took his Foley out, and 6 hours later he can't pee. So I bladder scanned him. I've got 200 cc's. Should I wait any longer and then bladder scan again before I do?
It depends on, does he have signs? Does he feel like he has pain?
There is some urine in there, but not a lot.
But not a lot. I would give it another 2 hours, and then following the protocol.
Yes.
Yes, follow the protocol, and then sometimes the doctor would. That's why some institution they would just immediately insert an in and out or do a Foley. But for us here, we want you to call the doctor because they know more patient, right?
Mm-hmm.
And so sometimes instead of doing the in and out, they want to keep the Foley. So instead of the more that you put Foley, the more that you access it, the more you introduce infection to the patient. So call them. Sometimes they might just do the regular Foley instead of in and out. If you've been doing bladder scan for quite a while,
Mm-hmm.
yeah, give them another 2 hours. I should say. And again, it depends on their symptoms. If they're hurting and they're hurting a lot, so yeah, we'll do that. Now, I would demonstrate to you how to use your regular Foley. Tell me when you're ready. Let me just set up for a quick moment. I need a trash on this side. A trash to this. So I can have 2 trash on this side.
These really are fun. Let's do that, Rob.
Good. All right. So I'm about to demonstrate to you how to use the regular Foley kit that we have. So by this time, I already know I have, should I say, 3 or 4 questions I have in my head. So I already have the correct reason. I have the correct medical necessity. I have a witness. All right, I have a witness. I have already asked the patient if she or he is allergic to latex or betadine. And then I already have the correct kit for myself. All right?
And in order.
All right, so everything is done. We're good. We need to insert Foley. All right? I will start with wearing my clean gloves. And I will open my kit. I will not throw this cover or the plastic of the kit. I will keep it here on this side, so I will have 2 trash. One on this side, one on this side. So I will prevent cross-contamination. All right? So grab the cover out. The first thing that you will see is your Ziploc bag. All right? So it says, stop, clean the retro area. And then, so when you open this, you have 2 things on there. You have your Castile soap. We got 3 towelettes on there. And then you got your Purell. All right? Now set aside the Purell first, put it on the side. We're gonna assume that we're gonna clean this, all right? So we're gonna open. After you open this, you'll have 3 towelettes. So you would clean the patient from the outside, throw it on that side. Take another towelette towards your side, throw it here, another towelette, and then center and clean. All right, let's pretend that I already used my Castile soap. The next thing that you will do, you would not go anywhere. You would throw your clean gloves, take it out. You already exposed the patient, you don't go anywhere. You grab your Purell, pop your Purell, and clean your hands. You have some paper here. So you have patient education, it comes in English, it comes in Spanish as well. So you can do that as well too. You have directions. So use. So, but just don't read it in front of the patient, okay? Just. All right. You have your yellow oranges. So you don't use the sticker anymore. So I've said you don't use anything to document when did you inserted your Foley. You don't have to put this at the back. We used to put this also at the back of the Foley bag. So we don't use this anymore. All right? And on the chart, we don't use this anymore. When you saw your kit the first time, you will see you have an arrow on your kit. So arrow should be pointing towards the insertion site. Forgot to mention earlier, this is what we call Sure Step Foley kit that we have. So I will tell you why did they call Sure Step, because it tells you step by step what to do. Beginning on cleaning, so it's A, right? It's A. And then B, you have to do your B. So arrow, pay attention to the arrows. Arrows pointing towards the insertion site. Number 1, open your drape. Number 2, don your gloves. Number 3, so it tells you step by step if you haven't inserted it for quite a while. So you open your kit. Again, sterile technique. The first thing that you will see is your sterile gloves, and then you wear your gloves away from your field.
I remember a while back they used to let us put our kits on the bedside table. They don't let us do that anymore.
You can do that. Yes.
The whole Foley kit, we can put on the bedside table before we put it in the patient, or does it have to go between the patient's legs?
I would still, so sometimes it depends on the patient. It should be in between it should be in the bed. Yeah. It should be in the bed. Yeah. So sometimes it's about proximity. The closer, the better.
Mm-hmm.
All right. You got your sterile gloves. The first thing that you will see is your tray. So this tray got the shiny, and then it got the rough side. So where is the shiny side going?
Down.
It should be going down. So you can also use this technique. You grab it with your thumb, and cover your 4 fingers, or you can grab it and then cover your 4 fingers. You're still sterile, and you put it there. All right. You ask the patient to lift their back. The next thing that you will see, using your card. I need your cards. The yes or no cards. All right. Do we use this or we throw this?
Yes, we use it.
We use it, very good. We use it. You don't want to use it? We have to use it. We have to use it, Kelly. All right. If we use it, do we use it this way or do we use it this way? The first, use it this way. Yes. Very good. Why? Why do we use it this way?
Territory. Sterile
Very
field.
good. Yes. So you expand you widen your sterile field right there. All right. And then if you do it this way, your sterile field becomes narrow. And there's no reason for, anyone knows what's the cuts, what's the purpose of the cuts right there? It's for the thighs, for the legs. So it makes more sense to have the thighs here and then you widen your surface area.
My thighs are not that skinny, Rex.
And then so, do you use it for female only or you use it for male and female? You have to use both, okay? You have to use it both. Now, you set aside the patient for a while, you drape the patient, you will take care of your kit. As I've said again, it tells you step by step. So here, number 1, open the betadine. But before you open your betadine, we want you to pop your stick, all right? So you don't stain your scrub suits, all right? Open your betadine. We're going to pretend we open our betadine. And then attach the water syringe. This is the $1 million question. Do you still have to check or just have to attach it?
Just attach. Just attach. Don't
Just
inflate
attach.
the balloon.
Very good.
Right.
Just attach. So just follow the instructions. What will happen if we will inflate it?
You create ripples in the balloon. It's not a smooth surface, and it will cause trauma when you insert.
Very good, very good. So when you check your balloon, it doesn't go back to its original form. So if it doesn't go back to its original form, it causes bladder irritation and bladder spasm. We don't want to do that. So we are assured by the manufacturer that they have checked the balloon. So don't check the balloon. All right? Just a touch. All right? And then so dispense the water lube. After you dispense the water lube, I'm just going to pretend I'll dispense it. You would lay down your Foley. So it depends on you. So with this, it got perforation on it. It depends on you if you want to rip it that way, or if you like what I did, if you want to remove it, it depends on you. So it doesn't matter. And then so you dispense your lube, dispense the Foley, and then loosen your Foley kit if you have to, so you can have a bit of access in there if you have to. Alright, and if you need to move your kit. Now, this is what I call the commitment moment. Mm-hmm. You have to commit. If you are not ready, don't commit. Don't commit. Mm-hmm. Don't commit. So, identify your dominant hand and your non-dominant hand. I'm a right-handed person. The dominant hand should stay on your sterile field. Your non-dominant hand should stay right here. It doesn't need to go back here. You don't want to cross-contaminate. Alright? So, commit. Alright? Your next option is to clean, not your option. This is your next step. You don't have option, you already committed.
Yes.
Oh my God. Alright. Okay. Clean your area. So the same thing, clean from the outside, you throw it there. I'll just pretend that I'm throwing it there. And then clean towards here, and you clean it here. So don't cross-contaminate, don't go back, alright? Just throw it here. And then the last one is on the center. So when you do the last one, you kind of do your anatomy so you would know where are you going, alright? So again, we have the cleaning earlier, and it is the sterile cleaning. So again, the more cleaning that you have, the better, alright? You're about to go in, just warn the patient, right? For this model, you're about to go just until here. We're not going to go any further, okay? So let's say we're about to go in. All right, we're in. And then let's say we got urine backflow. So we got urine backflow. After you have a urine backflow, you kind of adjust forward a little bit for 2 inches. After you do that, inflate. After you inflate, tug. So it's in place, and then disconnect. Right? After you disconnect, so you look for your stop lock. Again, if you forgot how to use your stop lock, just read it. So push, then lift. So push, and then lift. Again, arrow. Yes, go ahead.
Would you still have your same gloves on? You're sterile?
Yeah, you're still sterile. You can do if you prefer.
One hand isn't.
So we're done with the sterile technique, sterile steps. We're on the non-sterile. So you can still use it, or you can change it with a clean gloves. It depends on you. Or if you want to put your date and time and your initials, you can do that as well too. Yeah. All right. I would recommend putting it first instead of putting it in the patient's, because there's always a tendency that you will pinch the patient. So before you even do that, there's also sure prep, clean prep. Do your clean prep first. Wait for it to dry. While waiting for it to dry, again, see this arrow? The arrow is pointing towards the insertion site. Open your stat lock. Your stat lock got 2 parts on it. So you've got the smaller part right here, and then the bigger part of it. So the smaller part of your Foley goes to the smaller part, and then the big part goes to the big part right there. Make sure that you have that small white piece that will hold your Foley. Some would put Foley right there, and then what's the point of the securement device? There's no point. So always make sure that you put the big part to the big part, the small one to the small part, and then the arrow is pointing towards the insertion site, and then you remove your tape right there. So again, give a little bit room so that the patient can move even though so prevent some. This part right here is also important. This is what we call the linen clip. This is to make sure that you don't have loops on your tubings. So clip it there. This is why it's called linen clip. So put that on, prevent clip. Loops on your tubings. And then this is your air vent right here. So always make sure that this air vent is dry, always. And then your urine is half full. So like this now, this for instance right now, this is, let's say this is wet, it's sticking on the other side. So urine will just hang out in here. And then once transporter comes, what happens to urine, it will go back. It will regurgitate. So that's one thing, make sure that this is always dry. That's one thing, that's one of your responsibilities. So every day, aside from your manager asking you what's the purpose of the Foley, that why you still have the Foley, every day I'm telling you, there are secret shoppers that would go to your unit. What they will do, they would check if you got your stat lock. Your stat lock is dated, date and time. Your tubings doesn't have any loops, so use your linen clips, and then make sure that your air vent is always dry. And they always want to make sure that you also document your pericare.
And the red seal.
And the red seal, yes. Again, never ever break this seal. Always, again, think of the closed system, right? You have here as well your specimen collection, but you don't have to really use this. You have that vial with a vacutainer. That's the one that you would use for urine collection.
And I can only do that on insertion of a fresh one.
Yes, yes.
I got it.
I think I'm done. Do you have any questions? No? With PureWick, with anything, any other questions that you can think of? Foley, PureWick, did we cover everything that we need to cover?
Will you clarify again, which side of the patient do you clean first with the beta line? I always forget.
So you start with, to clarify, you start from the outside, you start away from you. So you start from away from you and then towards you, throw it towards you, center, and then towards you. You don't go. And then again, if you forgot, there's also a video, like a supplemental video on ECRS if you want to. But these are the supplies and equipments that we use, so we want you to be familiar with the equipments that we use in here.
Thank you, Rex. That was great.